Well, hello, everybody. We might get started. It's fantastic that you can join us, and welcome to PD in Your Pocket, free family daycare training for all your family daycare educators out there. Fantastic that you can join us. Of course, this is a fantastic opportunity for you to strengthen your knowledge and share insights and ideas with your colleagues. So I can see some of you are already doing that in the chat. So as we get started today, it's important that we take a little moment to acknowledge the traditional owners on whose country we're on. So let me start by sharing my screen with you and sharing some information about the country that I'm on this evening. So I'm here on the land of the Woiwurrung people of the Kulin Nation, and I particularly pay my respects to elders past, present, and elders who are emerging in our family daycare services across Australia. It's important that we consider the ways in which Aboriginal and Torres Strait Islander perspectives are embedded throughout our family daycare programs. And thank you very much for all of those who are thinking really deeply about the work that we do every day in early childhood education and care settings around Australia, and how we might incorporate different perspectives, the ways that of Aboriginal ways of knowing and being that have been part of our thinking over many eons, decades, in fact. My name is Catharine Hydon, and as I have joined you before, it's fantastic to be here once again to be talking about a really important subject matter. So we'll talk a little bit more about what we're going to talk about today, but it's great that we're here to talk about something that is of particular importance in the way that you practice your work every day with children and their families. So we know that lots of you are regular participants in the Zoom space, so you probably know all about how this works. And I can see that lots of you are already in the chat, which is fantastic. So keep your comments coming, keep your sharing ideas and strategies and insights, but also say hello to each other. I'm sure you recognise some of the people who are online today. So today is, of course, an opportunity for you, as I said, to think and talk together. And our subject matter today is hot topics. Now, hot topics, not in the sense that they are not allowed to be talked about. These are hot topics that we know are of challenge and sometimes complexity in the family daycare context. So we want to take a moment to dive into that space and really explore what that looks like. And we've got particular things that we're going to talk about tonight. But of course, it's important that before we do that, we just got to take care of a few housekeeping matters, as well as re-engaging ourselves in the Zoom space. So let's just quickly go through some of the things. I'm sure you already know some of these things, so we'll go a little bit quickly over this, but it's just good to remind everybody about these important things as you are starting the webinar today. So you will have received some information in a resource booklet, and I'm sure that all of you have had a bit of a chance to look through that. It's a specially prepared booklet, and it's a booklet that prepares you for this conversation. It's also a great way for you to continue to extend and expand your knowledge. So if you're watching this presentation, you might be also listening to it as a podcast. So follow the links and make sure that you find the hot topics section on the New South Wales Family Daycare website. You will also receive great content in the conversations we're having today. So our conversation today, as well as some expert advice and support in this webinar, it'll help you expand your thinking. If you're participating in this live or you're listening to the podcast, it's going to hopefully be PD in your pocket. So it's going to be a whole range of really great ideas that you can incorporate really quickly. It'll go for about 45 minutes. If you're listening to the podcast, it might go for a bit longer here, because there's additional information that you can engage with in this live opportunity. After the session, you'll receive a follow-up reading, so specifically chosen for you too, so that you can explore that topic in more detail. And of course, you're invited to continue the conversation on Facebook. I've been onto that site. It's fantastic. Lots of conversations and discussions on that Facebook page. We know there's some really good advice being shared and some thoughts and discussions. So please be a part of that conversation with your fellow family daycare educators across New South Wales. Great topics of conversation and great ways to share questions. Speaking of which, today we have a Q&A facility. So you'll see that if you go down the bottom of your screen, you'll see a Q&A function. So we'd really love you to share your specific questions that you might have for today in relation to our hot topics, and share those in the Q&A space. Keep talking to each other in the chat. great to have comments and conversations in that space. But if you've got a particular question that you would like to pose in relation to our hot topics, that's the place to put it. So now I know that there's going to be quite a few questions, and some of them might pop up that we can't necessarily answer tonight. We can't get to all those questions, but I have it on very good advice from the team at New South Wales Family Daycare that they are very happy to take those questions back, and they're going to think about the best way to answer them and to come back to you with some ideas to continue those conversations. Of course, if you have questions that are specific about your own service, that relate specifically to the regulations, you can always get in touch with the department. You can also talk to your approved provider. You can talk to your educational leader, your nominated supervisor. So have those sorts of discussions as well. But keep those questions coming. We're really keen to hear about those as we progress. So let's see if we can now have a look and see what hot topics we're going to talk about. As I said before, these hot topics are not things that we shouldn't talk about. These are topics that we want to engage in because we know they are complex and they're challenging in this space. So these are the topics we're going to cover today. Now, I'm sure that for some of you, these are things that might have arisen in your setting or things that you might have discussed in your context. And the session's been funded, as of course you all know, through the Department of Education and their Sector Development Program, New South Wales Department of Education. So we thank them for the work that they're doing to support you in this conversation. And if you've read the booklet, you'll also see that there's lots of things in these topics that are about compliance. And also the department is also finding that family daycare services sometimes struggle and are challenged in these particular areas. So we want to bring them to the surface and we want to talk about them, and we want to help you to be more compliant in this space. So what are we talking about? We're talking about compliance in terms of regulation around sleep and safe sleep. We want to talk about excursions, and we want to talk about transport, and we want to talk about the use of educator assistance. So for you, some of these might be really relevant, and for others of you, this might not be particularly relevant to you, but it's really important that you know about this so that you can make sure that you're compliant moving forward. So we know that learning about regulations is not necessarily as much fun as other things, but it is important. It's a very fundamental part of our professional practice as early childhood professionals. And it's really important. Why is it really important? Because it's about children's safety. It's about our commitment to children to act in their best interests. So it's about minimising the opportunities that there are for any risks to children's safety and ensuring that children have the best possible outcomes when they're with you in family daycare contexts. In knowing the regulations and the law, you're doing exactly what you need to do every single time. You're capable and competent as early childhood professionals. And in knowing what the regulations require, you know why you're doing it and how to do those practices. So what we're asking of you tonight is to think about these three areas: sleep safety and excursions, transport, and the use of educator assistance. So we're thinking about particularly children's safety when they're asleep and when they're on excursions. We're thinking about how their children are transported by you to and from your family daycare home, and the use of educator assistance in your care. So thinking about those three components. Again, if you've got questions that you want to share with us, use the Q&A facility, which is down the bottom of your screen. So let's take a dive into the first one as we get started. We're going to firstly talk about safe sleeping. So again, for lots of you, this is a subject matter that you probably learned about when you were doing your study, but it's important subject matter that we need to keep coming back to make sure that we are indeed compliant in terms of the regulations. So what are we talking about when we talk about safe sleeping? Safe sleeping is a way of putting babies to sleep under 12 months of age, so that it reduces their chances that they will die unexpectedly in their sleep. Sometimes babies die from either a genetic condition that they may have been born with, or because of sleep accidents such as suffocating or strangling. When there is no cause of death that can be found, it's called SIDS, S-I-D-S. SIDS, Sudden Infant Death Syndrome, I'm sure many of you have heard of that, accounts for 3% of all infant deaths. Although we have known and been taught about the right ways to put babies to sleep in family daycare for a long time, there are some of us who are forgetting to do all of the parts of our safe sleep strategies. So we might do one part, but not all of the things that we're committed to. And it's important that all parts of the safe sleeping process for young babies happen all together, and they happen every single time that you put young babies to sleep. So remember again, this is mostly for babies under the age of 12 months, and it's especially important for very young babies. So just a quick terminology check. You may have heard some changes in terminology, and we'll clarify this a little bit further as we get going, but it's important to clarify those terminologies. SUDI is a broad term used to describe sudden and unexpected death of a baby. So that's SUDI, and SIDS, another way of thinking about that. Different things though. And this sudden and unexpected death of a baby for which the cause is not immediately obvious. The only means to find out the reason for why a baby has died suddenly or unexpectedly is to perform an autopsy, the review of clinical history, and to investigate the circumstances of the death of that baby, including the death scene very thoroughly. Following this thorough investigation, some deaths are explained, such as accidental deaths. They might have been suffocated, for example. Something might be overlaying their sleep. They might be co-sleeping, for example. There might be an infection, for example. But but others remain unexplained. Sudden infant death syndrome, SIDS, as we know it, is an unexplained subset of the sudden and unexpected death of a baby. And when no cause can be found for that death, it's called SIDS. So we need to be clear about what we're talking about in relation to this. I know that sounds really hard to listen to because we hope that never happens, but it's something that we need to be aware of as early childhood professionals. So let's keep going and thinking a little bit more about some of the things we know about safe sleep. And again, some of you may be really familiar with this. Some of you might have recently read your policies and procedures in your context, which is great. So it's great to familiarise yourself with some of those things. And some of you may have had training in recent times, which is also clarifying some of the things that we expect in this space. So a safe sleep environment means that all potential dangers have been removed and the baby is sleeping in a safe place. And that's an essential responsibility of early childhood professionals. The ideal place for babies to sleep is in a safe cot, on a safe mattress, with safe bedding, in a safe sleeping place, both day and night. Unsafe settings for babies for sleep time include babies being left unattended on an adult bed or a bunk bed, placing babies on a beanbag or a couch or a pillow or a cushion, or sleeping with an adult or another child on a sofa or a chair or a couch. Keeping babies' cots away from hanging cords such as blinds and curtains and electrical appliances, as they could get caught around babies' necks. Keep heaters away from children, any electrical appliances, and avoid the risk of overheating and burns and any electrocution. Never use electric blankets, hot water bottles, or wheat bags for babies. So really important note, I think there, just say it again for clarification, no use of electric blankets or hot water bottles or wheat bags for babies. So again, some of these things may be very familiar with you and for you, but others of them might be a little bit new. So you might want to take some notes as we're talking and maybe go back to some of the information that we provided to you before the webinar today. So let's keep going and thinking about putting babies on their backs. So many of you will know that practice and will have undertaken that. But remember, one of the things that's really important in this context around safe sleeping is to make sure that all of the components of safe sleeping are acted on every single time for all children all the time. So always put babies to sleep on their backs. Of course, some babies, especially older babies, will wriggle around to other positions, but if you start them off on their back, then it helps them to keep their airways clear and ensures that their protective reflexes can work. Healthy babies placed on their backs to sleep are less likely to choke on vomit than tummy sleeping infants. Rednose think that this recommendation has largely cut down SIDS, sudden infant death syndrome, by 85% since 1990. So a really good evidence-based strategy. When a baby sleeps on their stomach, the esophagus sits above the baby's airways. So, and if the baby regurgitates or vomits any milk or fluid, these substances can pool in their airways and they're more likely to be inhaled by the baby and go into their lungs. So we must always put babies on their backs. And it's something really you might want to talk about with families as well, encourage them to understand what your own practices. So really important part of our ongoing work in this regard. And in terms of safe sleeping, we want to also make sure that we are regulating their temperature, and we're also making sure that we are looking at their head and their faces and making sure that that space is uncovered. So babies control their temperature through their face and their head. So keeping children's babies' faces and heads uncovered during sleep helps to reduce the risk of overheating. It also helps them to keep their airways clear, and that reduces, of course, the risk of suffocation. You can use blankets firmly tucked in, only pulled up to their chest, but you need to use lightweight bedding. Research has shown that baby's risk of dying suddenly and unexpectedly is increased if baby is sleeping on their tummy, and the risk is even further increased when a baby is sleeping on their tummy under heavy bedding, or if the baby's head becomes covered by the bedding in any position. So overheating can caused by room temperature, so overheated in rooms, and by high body temperature and excessive clothing or bedding is a risk to children. So to reduce the risk, the Rednose community recommends that you use your own judgment. So taking into consideration what's happening in the weather and factors like where you live, obviously that's changing in different parts of New South Wales, and thinking about what might be going on in your house in terms of heating and whether the baby has a cold or any minor illnesses that they have, and also to think about their temperature and to monitor that. So we also might want to consider dressing babies for sleep using layers, as we would dress or use layers ourselves. So we put more on when it's colder, less on when it's warmer, and to be comfortable, but neither too hot nor too cold, and remove any lightweight blankets to ensure children's chest becomes comfortably warm to touch. So it's a good way of checking. A good way also to check is to feel the baby's chest or the back of their neck, which should feel warm, but don't worry if their hands and feet are a little bit cold. That's normal. So ensure baby's head is uncovered, no hats or bonnets or beading or beanies or hooded clothing at all. And as we said before, never use an electric blanket, wheat bags or hot water bottles for babies. You can also use a safe baby sleeping bag. So some of you might have used something like that before, well fitted across the neck and chest, with an opportunity for babies' arms to be out, no hood. And research has shown that among the benefits of using a safe baby sleeping bag, a baby in a sleeping bag with a fitted neck and armholes and no hood, and that needs to be the correct size for the baby, of course. The benefits of using this is that you reduce the risk of bedclothes covering up baby's face, and they delay baby rolling onto their tummy during sleep. And also it gives, it's important in terms of reducing the risks. It also promotes back sleeping as the zipper opens at the front, and they will also keep baby's body temperature at a constant level while they're sleeping. So that might be something to consider and talk to families about as you work with them. So some of the information on the screen now should be familiar if you've read some of the material, and of course you can continue to revisit some of these ideas in the podcast if you want to familiarise with some of the detail, because we know there's quite a lot of detail in the conversations we're having with you today. So let's keep going and think about at the foot of the cot. So many of you will know of the practice of placing children at the foot of the cot. If blankets are being used instead of, say, a sleeping bag, it's recommended that you place the baby with his or her feet at the bottom of the cot using layers of lightweight blankets that can be added to or removed according to the room temperature. Tuck the blankets in firmly so they cannot come loose or cover up the baby's head during the sleep. Why? You will need to watch the interview at the end of this webinar. So for those of you who are listening on a podcast, you might come back and have a look at that to hear more about the reasoning for this. So we'll get some expert advice in relation to that. So can you wrap a baby? It's a very good question. Wrapping can be a useful method to assist babies to settle and stay asleep, as it reduces crying time and episodes of waking. Wrapping has also been shown to provide stability, which may also keep babies in the recommended back position. When wrapping a baby, ensure that the baby is positioned on their back with their feet at the bottom of the cot, like we've said. So really important, that positioning at the bottom of the cot. And then make sure that he or she is wrapped from below the neck to avoid covering their face, and also making sure that their face is completely uncovered. Use really lightweight materials, cotton or muslin, and baby rugs and blankets that are not safe alternatives may also cause overheating. So have a think about the materials that you might be using. For wrapping to be effective, the wrap needs to be firm but not too tight. You might want to get some advice about that if you've never done that before. Techniques use tight wrapping with legs straight and together, increase the risk of abnormal hip development, so be careful when you're doing that. And also loose wraps are also a bit hazardous because they might come off and cover baby's face. So ensure the baby is not overdressed or under the wrap, so you don't want them to overheat. And use only nappy or singlets in the warmer weather to ensure that children don't overheat, or a lightweight grow suit in cooler weather. If you wrap a baby, consider the baby's stage of development. Leave their arms free so they don't get startled. When they do, they can move their arms, and those sorts of reflexes can be a bit freer. So most babies eventually resist being wrapped. So wrapping styles should be appropriate for the baby's developmental age, and you need to discontinue wrapping as soon as the baby starts to show signs that they can begin to roll, especially probably about 4 to 6 months of age, but sometimes younger. So lots of information there about wrapping babies and positioning babies at the foot of the cot. So some more information there. You might want to revisit that so that you're really clear about some of the expectations around where children sleep and also the wrapping process. So let's keep thinking about safe sleeping. So one of the things that's really important around safe sleeping is nothing else in the cot. So you saw the image just previously. There was just the baby in the cot and the blankets that you might have tightly wrapped down the bottom of the cot. So nothing else hanging over the top of the cot, no other things in the cot, no doonas, no pillows, no cot jumpers, no lamb's wool, no soft toys, nothing that could get caught in around them or under them. And when we say no, we really, really do mean no. And nothing dangling from the side, so nothing around that. No matter how lovely the product is that you have, or maybe a family might request that they need to sleep with something, it's really important that there are no items in the cot except for the baby themselves, and nothing around the baby's neck. And we know that Rednose does not recommend placing anything around the neck of a sleeping baby, as this could tighten during sleep and make breathing more difficult and may strangle the baby. Furthermore, strings of beads could break, and the individual beads could end up in babies' mouths, presenting a choking hazard. The Australian government have issued a warning notice around the use of amber teething necklaces, bracelets and necklaces of amber beads, because they are a choking risk. So again, something that it's important that you're mindful of. So nothing in the cot, really important message there. So let's keep going, and making sure the cot itself is very safe is also a part of our responsibility as early childhood professionals. So let's have a think about what we mean by that. Ensuring your cot complies with the Australian standards, so Australian Standard 2172. If you're using a portable cot, ensure that it also complies with Australian Standards 2195. And you can find that information out when you purchase the product. Look for the Australian Standard labelling, ask questions, find out information about that. If you're not sure, find out before you buy it. Any cot made after 2003 and commercially sold in Australia is legally required to have an Australian standard, but you can also check. So check the products, and you can find that on productsafety.gov.au and find out more information. Ask the manufacturer, ask the company that you're buying it from. Use a safe mattress, one that is firm and clean and flat, not one that is tilted or elevated. Don't put any other mattresses on top or anything else underneath them, and anything else other than the firm, clean and flat. So don't put another mattress on top of the firm mattress so that the porta cot might come with. So really thinking here about not only the structure of the cot itself, but what happens with babies in their cot and the surrounding environment that supports children to safely sleep. So again, it's something that you might want to look at in terms of your own cot. You might want to make sure that it does meet the requirements. And of course, one of the things we also want to talk about here is only putting them to sleep in a cot. So only putting children to sleep in a cot is a really important part of keeping children safe. So unlike cots, there are no Australian safety standards for bassinets. So that's why we use cots in family daycare, and we don't recommend at all putting the children in a bed or in a lounge or a beanbag. As I've said before, the safest place is for children to be in a cot. And the last thing that we want to say particularly about children as they are sleeping in family daycare is to make sure we check on children. So checking on children is a very important part of the work we do as family daycare professionals. And it's important that we take note of some of the recommendations of the New South Wales Department of Education in relation to this, particularly in relation to adequate supervision. So of course you all know about adequate supervision, but again, we need to remind ourselves in the context of safe sleep. Adequate supervision at sleep and rest times involve checking and inspecting sleeping children at regular intervals, always being within sight and hearing distance of sleeping and resting children, so that you can monitor children's breathing, the colour of their skin, and these can be assessed. Taking into consideration the risk of each individual child, and also considering the age of the child, medical conditions, individual needs, and history and health or any sleep issues. A family daycare service should have documented practices for the supervision of sleeping children, tailored to the unique layout and safety consideration of each family daycare residence or venue, as well as the ages and developmental stages of the children in care. So that's the specific advice from the New South Wales Department of Education, worth noting in terms of your own practices. Are you checking and inspecting? Are you always within sight? Have you taken into consideration the risk for individual children? Are you thinking about the individual child's medical conditions, individual needs? And what is the documented practice for the supervision of sleeping babies? Something to talk to your nominated supervisor or educational leader about if you are uncertain. For example, a service should ensure that children are not placed in a bedroom if they are not within sight and hearing distance of the educator or educator assistant, or would have access to medical and other dangerous items. A family daycare educator must consider that they have a documented procedure for the manner in which they will supervise and conduct physical checks on sleeping babies whilst they are maintaining adequate supervision for the other children in their care. A family daycare educator must check that the child is breathing by checking the rise and fall of the child's chest and the child's lip and skin colour from the side of the cot or on a floor mattress, the toddler bed for children who've moved from a cot. These checks should occur once every 10 minutes. Baby monitors are not a substitute for a physical check. So that specific advice comes from the New South Wales Department of Education. We know that the New South Wales Family Daycare Association knows that the department's guidance for family daycare is about always having children within sight of educators is not necessarily as practical as we might think. So for most family daycare homes, that might be a bit challenging. There's currently conversations going on with ASIQA and the department about this issue on behalf of members. So watch this space. The two key things are that services need to have a documented procedure for the supervision of sleeping children in each educator's home, and that each educator needs to check and have a documented procedure about how they conduct their 10-minute check. So in the context of this, it's really important that each individual educator knows the regulations. So this is an important ethical and professional responsibility we have as early childhood professionals to know the regulations within which we work. So I know some of you, of course, will have read details of the regulations. I'm sure you all know where your copy is, and I'm sure some of you have clarified those things with your coordinating team. But it's important that we do understand what the regulations require of us. The regulations in regard to sleeping safely require that family daycare educators ensure that babies get the sleep they require, a very important part of growing and learning. Family daycare educators should follow their services sleep and rest policy. So make sure you know what that is. And your services policy has to require that you take reasonable precautions to protect children from harm and hazard, that children should sleep and rest with their face uncovered, that children sleep in quiet, well-ventilated and comfortable places, that children shouldn't be forced to sleep or stopped from sleeping, that you adequately supervise sleeping children at all times. Your services policy and procedures must be based on recommendations from Rednose, as they are recognised national authority on safe sleeping practices for infants and children. And if you think your services policy does not reflect the recommendations that we've talked about today or the requirements we've talked about today, then it will be an important thing to raise with your service. And remember, one of the things around the hot topics we're talking about here is that while some of you are practicing some of these things some of the time, what we need ultimately to have happen is that all of us are practicing all of these things all of the time, and that we feel very confident in making sure that these things are happening every day with children in family daycare homes. So we are going to ask something of you now, and up on the screen in a minute is going to pop up a poll, and we're asking you to share some of your thoughts with us about what you do in practice. And this information will help the team at New South Wales Family Daycare to talk further to the Department of Education in relation to the safe sleeping practices. So as you can see this on your screen here, hopefully you can all see that, and we'd love you to take a moment to complete this. So just as we're going to do a small poll here, as I said, only a couple of questions, and with the people who are listening on the live webinar, then this is who we're going to ask to participate here. So there's about 700 of you, so it'll be great to get your thoughts about this. And we'd like to know if people are currently having babies sleep in a room where they can see them or whether they're not. So the first question here is, do you currently put babies to sleep where you can see and hear them? So there's a single choice question, a yes or a no, or I don't have babies. And the second one here is, would you be able to put babies to sleep where you could see and hear them if the regulations were changed? So in the second poll, it'll pop up on your screen and it'll give you an opportunity to answer those questions. So I'll just give you a little second to answer those questions. That'll be fantastic. And hopefully there's a number of you who's sharing your thoughts. So we'll just wait a moment for that. If any of the information here that we've provided, and I know it's quite a lot of detail, if you have any questions or queries, then the material that we've sent you in preparation for today is really important, but also this is a great opportunity to raise these things with your service, have a further conversation with your educational leader or nominated supervisor, talk to your approved provider about some of the things that you might be uncertain about. And of course, you can always check with Rednose, or you can also have a conversation with the Department of Education. It's always really helpful to get that information and clarify exactly what you mean. So our ultimate goal here is to be able to practice great, safe strategies for young children sleeping all of the time for every single child. So I think, and Wendy in the team from New South Wales Family Daycare, I think we might have hopefully got lots of people voting. I can't really see that, so I hope that everybody has participated there. We'll give you a couple more minutes just to share your thoughts here. That information is going to be really valuable for the New South Wales Family Daycare team to continue the conversation with the Department of Education in New South Wales. So thanks very much, Wendy. I think we'll leave it there. And again, if you have some more thoughts, then please share them. Oh, there we go. There's our results. So you can check that out, everybody. The results are really quite interesting. We've got a number of people who said yes to the first question. Do you currently put babies to sleep where you can see and hear them? So a lot of people said yes. So quite a few of you don't have babies. And would you be able to put children to sleep where you can see them if the regulations changed? And most of you said yes, which is great. Thank you very much for sharing that information with us. So let's keep going and have a look at the next hot topic. So as you can see, hot topics are about us engaging with things that we think need more conversations and deliberations by us as a group of professionals, and something that we need to have more discussions about so that we make sure our practice is consistent and safe for all children. So another aspect of the safety component, another hot topic around the safety component that we want to talk about is safe transport, something that I know quite a bit about because I'm doing some work here in Victoria, because as I said, I'm from Victoria, in relation to the safe transport of children, because family daycare is a place where lots of children do get transported. So what are the main issues in excursions and the transportation of children? The main issue in terms of safety and compliance is that in excursions and transport of children in your service, you need to have policies for both, and you need to follow them at all times. So we come back to that really important concept in the terms of these hot topics, is making sure, and particularly in the safety space, that safe practices are consistently practiced every single time for every single child. So we want to make sure that's really consistent in our practice. Children cannot be transported by a family daycare educator or educator assistant unless there has been risk assessments done first and you have written permission from the child's family. So specific things set down by the regulations need to be in those risk assessments and in the authorisations. Not having those things means you are breaking the law. So you're in breach of the regulations. So ensuring that you've got very clear permissions from families, risk assessments, permissions for all of those components is a really important part of what you do on a regular basis. Now, of course, lots of you will be familiar with transporting children to and from school, perhaps to and from preschool. So lots of different ways that you might be doing that. And many of you will be doing a great job in terms of risk assessments and permissions from families. But again, we need to make sure this is consistently practiced. So let's keep talking a little bit more about what we might mean by risk assessments and excursion and transportation policies and practices. The Department of Education has informed New South Wales Family Daycare Association that the requirements relating to excursions and transportation, in relation to that, most family daycare services are struggling to meet particular components. So these are the particular issues that we need to take a little bit more of a deeper dive and have a look at, and that we should particularly note. So not having locations on authorisations where you are taking children to and from. So be really specific in relation to the locations on your authorisations. So informing families about where you are going very specifically, not just to the park. Which park? Where are you going? So not covering hazards on the way to the location and in relation to the excursion in the risk assessment. So if you're walking to a local park and you have to go across a bridge or across a road or around a roundabout, where are you going? Past a lake, you might want to you have to, in fact, be very specific about the risks and the hazards on the journey to the destination. So making sure you're clear about those things that are hazards on the way to the location that you're going to. Also, something else that the Department of Education has notified New South Wales Family Daycare about is that we are seeing too many people not having authorisations for families, or authorisations not covering everything that they need to cover. So the authorisations themselves need to be comprehensive, and we need to cover everything that's required. It's important to remember that the regulations state everything you need in a risk assessment and in an authorisation. So we need to go back to those regulatory documents and make sure that that information is clearly adhered to. If you're uncertain, again, check. If you're uncertain that your documents might not meet that requirement, again, check. Very important to check to make sure those things are clarified. In a risk assessment for an excursion, for example, it's what the risks are, how much of a risk they are, and how you will manage and minimise those risks, the route that you're taking, where you're going to, any water hazards, any risks around water, how will you be transported, seat belts, safety belts, how will you get into and out of your house, wherever you're going, how you'll get into and out of that place. What might be a particular risk on a car or a bus or a train if you're taking another adult with you? What are you going to do when you get there? How long is the excursion, and what you will need to take with you? So a comprehensive risk assessment that tells you all of the details. Now, of course, if you're going to the same place regularly, one of those will be really helpful, but it's important that we get authorisation for children to travel every single time they travel. I'm not going to go through all of the areas for safe transportation of children or what the needs are for authorisations, because you can check the regulations yourself. I know that's a really comprehensive document, and again, you might need some assistance in that regard. So really talk to your service, talk to your nominated supervisor, talk to your educational leader, talk to your colleagues, check with the Department of Education if you are unsure. So make sure you're using the services forms and that the parents are filled in those forms. So it's really important to check from time to time. Now, you might have forms that you've been using for a little while. It's also really important to check those from time to time to make sure that they are up to standard. And some of you might have had a conversation with an authorised officer. You might have had a conversation with your service to make sure that those things are regularly checked, to make sure that they're compliant. So a really good opportunity for you to check some of that material so that you're making sure that you're very confident about what the regulations require. Speaking of which, let's have a little bit of a check to see what the regulations say in this regard. Again, a bit of a whistle-stop tour, but let's have a look at them to make sure that you are clear about them. So the regulations require that your service must have an excursion policy, and if you pick up children or drop them off anywhere from school or anywhere, you need a transportation policy. That you're required to take to only take a child out of your home when you are taking them on an excursion. So that is every time you take them out of your home, that is an excursion. You must do a risk assessment before any excursion, once every 12 months if it's a regular excursion. So as you can imagine, sometimes hazards change and things might have changed. If you go to a particular place on a regular basis, it's really important to revisit that. The regulations tell you what you must cover in terms of a risk assessment. Your service will have some of that information, but it's also helpful that you know, and that you must get parents' permission, written permission for all excursions once every 12 months for regular excursions so that they know exactly what you're doing. The regulations tells you what you must have in a written permission. And that where you are transporting children other than on excursions, you must do a transportation risk assessment and have a transportation authorisation. If the transport is regular, for example, you always pick up that child from school on a Tuesday, this can be done by every 12 months. The regulations tell you what must be required and the risk assessment and authorisation process. So again, we've got really clear information that's available. And one of the things that we want to get out of today is to make sure that we are feeling increasingly confident about complying and making sure that everybody is doing all of the things that they're required to every single time. So eventually these don't become hot topics, they become things that we do well all of the time, and we can be really confident about the way in which we're complying. So if you're uncertain about those things, it always pays to check, double check just to make sure that you know what you're doing. And if in doubt, make sure that you clarify it before you act. So there's our conversation around safety. I know lots of information there, so some of you might want to revisit it in the podcast so that you can get a little bit more information and think about some of the implications for you in your practice. So now we're going to talk about educator assistance. So for some of you, this is very relevant. For others, you not so much. So not all educators and not all services have educator assistance. So those that do have them to fill in for educators when they can't do something themselves, like drop a child or pick up a child from school or aftercare when the educator suddenly gets sick in the middle of the day, for example. They are mostly used in emergencies and to make it easier to get children to and from school when an educator who also cares for younger children or babies needs some extra help, or to work with educators when an educator is also caring for children. But educator assistants also need the same qualifications as the educators, and there is defined, specific and limited situations where you can use them. So it's important that we, again, comply with the expectations that are required in this space. So let's make sure we're clear about what we mean by this process. So you can only use educator assistance in defined ways that are defined by the regulations. So you cannot use educator assistance without each family's written approval. In situations not allowed under the regulations, for example, when an educator has to attend an appointment that isn't unforeseen or exceptional. So when it's unplanned is when that situation is allowed. When it is foreseen and not exceptional, something that is planned, then it's not allowed. By swapping the roles so that the educator assistant minds the children at home while educators pick up children from school, they cannot be used. When an educator needs to use an educator assistant so that children can be picked up from school, it is the assistant that should do the pickup while the educator cares for the other children as usual. Essentially, these educator assistants are people who are there for emergencies or for transport. So again, same qualifications are required and written approval is required. Now, this might not be the case for the service you work in, but it's really important that we comply with the expectations of the regulations in relation to educator assistance. So again, Let's make sure we know the regulations in this space. So again, if it's relevant to you, this is a time to pay really close attention to the way you are using your educator assistance. Not so relevant for you, still important that we all know what the expectations are across the board so that if we were in that position, we could make sure that we were compliant. So only using educator assistance to drop off or pick up children from school or from home to another education and care service. So that transportation space, if there's an emergency and you require urgent medical care, so unexpected, unforeseen, and if you need to attend a short appointment that you couldn't have known about in advance, so your service needs approval for this, to approve this, and you need to notify the families. And it's important that you use educator assistants to work with you. So you must be present in relation to that. So the regulations say that you can use educator assistants if the family daycare services approve them, if each family has also given their written approval to use assistance in the circumstances that we've just outlined, dropping off or picking up children from school, if there's an emergency, if you need to attend a short appointment, and you also need to work with them. The regulations also require that educator assistants be over 18, have a working, or are working towards their Certificate 3, and have a first aid and child protection training. So very important specific expectations in relation to those particular educators. So important for you to note that even if that might not be something that you use, it's helpful that we all know how what the expectations are so that we can comply if we are in that situation. So lots of information to take in here. Now, it's not that we have to be able to recite all of these expectations when you're quizzed. You're not going to be in a situation like that. But it's important that you know that there are expectations and that if you are in daily practice in relation to something like safe transportation and safe sleeping and the use of assistance, for example, that you are clear about those expectations if you are undertaking that work. If you need clarification and you need to make sure that you fully understand it, it's a really important conversation to have with the service that you work with so that you are really clear about it. And again, if you have any clarification questions that are required, get in touch with the New South Wales Department of Education or have a conversation with your service. So we are now going to hear some video presentations, which is fantastic. So we get to hear a little bit more from some fantastic experts who can share their insights with you about some of the things that they know, and they're going to be interviewed by the lovely Lisa Bryant. So can I'm going to turn my screen off, my face off, my photo off, that's better. So you'll be able to just concentrate on the video here.
Hi, I'm really pleased to be joined today by Jane Wiggle from Rednose. Hi, Jane. How are you?
I'm well, Lisa. How are you?
I'm good. I understand you're Chief Midwife of Rednose. What does the Chief Midwife of Rednose do?
Oh, lots and lots and lots of different things. I'm spread quite thin across the organisation, but it's a lovely position to be in because you can help families from a grassroots level, but then you can help contribute to really fantastic pieces of work and, you know, strategy and things like that we need to continue our work. So yeah, it's a lovely position.
That's great. Look, I've promised all the family daycare educators that are watching this video that I'd ask you one question first off, because it just doesn't make sense it does make sense to me, so I'm presuming it doesn't make sense to them. Why do we put babies to sleep at the bottom of the cot? Everything else kind of makes sense, you know, and don't have toys in the cot, etc. But why at the bottom?
Yeah, well, this one actually speaks directly to our second safe sleep recommendation, which is about keeping the baby's head and face uncovered. And that's for two really important reasons. The first reason is to make sure that we don't obstruct a baby's airway in any way, shape or form. And we know that babies, particularly young babies that are sort of 6 months of age or less, are preferential nose breathers. And so if we cover their face in any way, shape or form, we're increasing their risk of suffocation and asphyxiation. So that's the first reason. The second reason is because we know that babies modulate their temperature, or they regulate their temperatures through their face and through their head. And we need to make sure that we don't interfere with that in any way, because overheating is a significant risk factor of SIDS as well. And so by placing baby down the bottom of the cot with their feet touching the bottom and bringing bedding just up to the level of the chest, you're preventing that baby from wriggling down under the covers and accidentally overlaying the face to asphyxiate the head to overheat. And that's the reason. And it's
that makes sense. I just couldn't work out the wriggling bit.
Yeah, because we all move in our sleep, whether we're an adult or whether we're a baby. We're not still so. That's what we have to always make sure that if we're going to wriggle, we don't have very far to go.
Fair enough.
Yeah.
And can you tell me, I understand that the rate of cot death SIDS is so much less than what it used to be in the 90s. Have we really just managed, or has your organisation really just managed to do that by educating families and educators and everyone else about how to put babies to sleep? Is that what's happened?
Well, it really was the most successful public health campaign that ever was in this country. And I know I say that and I sound horribly biased, but it really was, because we saved we continue to, but we've saved well over 10,000 babies' lives now. And it's just through really excellent research, people that are really willing to help translate that into great education, and then people willing to be engaged and listen and keep the conversations going. Because as soon as we stop educating and we stop speaking about the importance of safe sleeping, those numbers can and will increase. So it's about asking questions all the time, being interested, slowing down and stopping for a moment and checking, is this a safe situation for a baby to sleep in? Are the airways compromised in any way? Is there something I can do to help that baby help itself?
And one of the things that our Department of Education is telling family daycare educators is that they have to check a baby every 10 minutes when it's sleeping. What are they actually checking at that point? What should they be checking?
Yeah, so there's two parts to the checking that are really important. And it's not only the frequency of the checking, but it's actually the quality of the checking. So we don't want to be glancing through a window or quickly opening a door to sort of have a bit of a look. We want the viewing of the child to be really diligent, active, and really effective, like really going up beside that child and having a really good look. And it's about the rise and fall of the chest, it's the colour of the skin, and it's just taking note of, does that baby look the right colour? Does it look the same as it did when I put it down for a sleep? Are they having trouble breathing? Are they breathing too quickly? Is that a funny sound coming from them when they breathe? I don't know. All of these things should evoke some kind of emotion or ring some bells to make you think, I think I need to escalate. So we need to be, because we could open the door and check a baby, and a baby could appear to be sleeping, but that baby could be in respiratory distress. And babies can go into respiratory distress silently. So it's really important that we go up to the children and have a look. Don't disturb them. You don't need to. Just have a good look at them. Skin, work of breathing, and then go from there.
But we're all really worried, it's been a while since I've had to take care of sleeping babies. But by the time I got them to sleep, I didn't want to disturb them. There was the chance I'd wake them up again. How do you manage that?
I know it's a tricky thing, isn't it? Especially when you've got, you're in the family daycare setting, but when you have parents that are really tired and they're really desperate, but it's about empowering yourselves and parents with really safe settling strategies, but understanding that, when your baby wakes up, it's waking up for a reason. It's normal infant and child behavior, even though you just want to drink a cup of tea that's actually hot. We've all been there. I'm a parent as well. But, the arousal from sleep that occurs is actually an airway protection reflex. It's one of the 5 airway protection reflexes that babies have inbuilt. And we know that one works best, in fact, when the baby's on its back in the sleep environment. So I know
what are the others?
The others,
Yeah.
So we've got a suck, so sucking, swallowing, gagging, vomiting, and waking up from sleep. And the two that work really well in particular when they're on their back in a sleep environment is swallowing and waking up from sleep. So you kind of think, oh God, I don't really want you to wake up from sleep 10 times a night. But we need them to, because it's an airway protection reflex that they're doing. It's normal and it's healthy and it's important. And we also need parents to know that too. It's okay. I know your kid woke up 10 times in the night. No, it's dreadful for you. You must be so tired. But guess what? Your kid's really healthy, doing all the right things it's meant to do. It's really good. Hang in there.
Okay, what about blankets compared to sleep suits? Which is better and why? And
it's really up to it's parent choice when it comes to the bedding that you use to an extent. So if you've got a really young baby, so a baby that's not yet rolling, you might consider wrapping that baby in a muslin or a cotton or a bamboo wrap. And then you'll place that baby feet to the bottom of the cot on their back. And then you'll put some lightweight bedding just up to the level of the chest and firmly tuck that baby in. And that's a beautiful and safe way to sleep a baby. Once that baby looks as though it's approaching the milestone of rolling, so it hasn't rolled yet, we're just on our way. You can see, you get a few clues when you're playing on the floor that this is going to happen soon. You need to unwrap the baby, have the arms out, and you choose a sleep bag that is really well fitted across the chest and the neck, because you don't want babies, when they lift their arms up, as they do, to pull it up over their heads and fall into the bag, which can happen, covering the face and the head, so they overheat and they can asphyxiate. So you want a bag that is well fitted across the neck and chest, sleeves or armholes, and no hoods or head coverings, and they're the safest sleep bags to use. And if you choose to pop a baby in a sleep bag, you want one with design specifications as I've described, but then you don't need to use blankets, because that's essentially your bedding all in one. That makes sense? So
okay.
It's either.
And what about in family daycare? Sometimes parents will give you instructions or requests that would contradict with what Rednose would say. Like they'll say, oh, look, she always sleeps better if you just put her in the pram, wheel the pram a bit and then just let her sleep in the pram. How do we as family daycare educators go about, explaining Rednose recommendations to parents?
Yeah, that is really, really hard. I understand where you're coming from totally. I think it is really important that you remind the parents that it's your responsibility. Once they hand their precious child over to you, you then have a duty of care to keep that baby or that child as safe as you possibly can. And the way that you're going to do that is to follow the Rednose Safe Sleep recommendations, because Rednose is the national authority in safe sleeping. And that's what you need to say to them, because if you go outside of that, you're suddenly outside of scope for yourselves. You're not protected. And then if something catastrophic happens in your care, what then? So you turn to those parents and you say, I understand, but when I'm caring for your baby, I have a duty of care to your baby and to you to protect that baby. And in doing so, we follow the Rednose Safe Sleep recommendations.
That sounds like a wonderful response to me.
Yeah, because
what about educators? Like, some educators are young, some educators are slightly more my age, right? And some of us think, oh yeah, look, I never did this with my children. I put them to sleep on the ground. Like whatever worked.
Yes.
And so because of our own experiences as parents and grandparents, we can be a bit cynical about, some of the recommendations.
I can understand the cynicism, but I would turn it around and I view it in a different way. And that what was done in the past, what you did for your children and what, you know, and those before, you as mothers did the best that you could do with the information that you had. Now 40 years have gone past and we've had the luxury of time, and in that time we've had research. We've had a good chunk of time where we've got some answers and we've learnt some things now. So now look at what we've got. We're going to do the best with what we've got now, because now we know. It's like, I guess if you compare it to seat belts, back in the day there were no seat belts, but now everybody has a seat belt because we've had the luxury of time, research, we've got some answers, so now we're going to implement them.
Yeah,
So,
okay. That sounds pretty good to me. If there was, last question, if there was, you know, like I know that Rednose has a number of recommendations, but if there was one thing you could say to family daycare educators, what is it that you'd say to them?
I would say that I'd say two things. Most importantly, to always place babies to sleep on their back. And that's because those beautiful airway protection reflexes work best in that position. And we're going to allow that baby to help itself as much as we can. And then wherever you're placing that baby to sleep, it must be a safe sleep environment. So it needs to be free of anything that could potentially pose risk to that baby's beautiful airway. So we don't want loose blankets, we don't want lambswools or bumpers or toys or anything in that space that is provided for that child that could potentially add risk. So if you see something in there, just get it out. Remove as much risk from that baby as possible. Keep those babies really safe and continue doing an amazing job.
Thank you. And thank you for joining us. It's been really good to talk to you.
You're very welcome. Thanks for having me. Bye-bye.
Well, that was a fantastic bit of information there from Rednose. So hopefully there were some things that were questions that were answered there. So we're now going to move to the next video, which is fantastic. So we've got an opportunity to hear from another expert who's going to share some insights with us today. So this is a conversation with a family daycare provider. Again, I'm going to stop sharing my face and you can concentrate on the video.
Hello and welcome to PD in a Pocket. I'm really excited here to have today a nominated supervisor from an actual family daycare service. I've got Christine Eldridge from Campbelltown Family Daycare in Sydney. How are you?
Good, thanks, Lisa. How are you?
I'm good. We should just let people know that we're recording this in the middle of lockdown. So hopefully when people actually get to see this, lockdown will be a thing of the past.
Yes, fingers crossed.
Yeah. How are your educators coping with having to work during lockdown? Are things okay?
Yeah, good. I think it's now second nature. It's, they've done it before and they did a great job then, and they'll continue to do a great job this time. So, yeah, good.
That's good. Okay, so we're going to talk about risk assessments and transport and excursions, etc. So, first of all, do your educators do their own risk assessments for excursions and transport, or do you do it for them as the service?
So when they were first introduced, and I guess as different excursions come up, we absolutely have templates that we have put together at the service that we can send out to the educators that have, generic things on them that potentially will happen during an excursion or a risk or a hazard that they may need to look out for. So the educators use those as a base. But then they create their own. So obviously every educator does things a little bit differently. Some travel by car, some by public transport, some are walking. So they need to actually complete that on their own so that it is reflective for what they do in their service when they are out and about.
Okay, and do you find your educators have problems doing those risk assessments, or are they is it by now just something that they're used to and can do?
Yeah, now they're really, really good at it. Obviously, you know, sometimes they find that for a different venue, something different might come up. So they may have a discussion with either myself or one of our coordinators to just unpack that a little bit and see what they would put in. With their risk assessments, they do send them through to me for approval before they go on the excursion or show the parents as part of our authorisation. So they do have that backup that if there is something that's in there that potentially they haven't unpacked, or those little graphs where the matrix can be a little bit tricky sometimes. So we just have those discussions around that, and obviously support them through making sure that that risk assessment is the best and has the most minimisation that they can to prevent something from happening while they're out and about.
And Christine, can I just ask, do you have a lot of educators who English is a second language? Because I can imagine that little graph and all the rest of everything to do with risk assessments would be a lot harder if English wasn't your first language.
Yeah, we do have quite a few that English is their second language. We probably have about 85% where English would be their second language. We did find with our first lot of risk assessments that the matrix that we used that Council's WHS helped us put together was actually quite complicated, and that the educators were having trouble deciphering that and working out, you know, what line they had to follow and what letter. So we did go back and we did work with WHS and came up with a more simplified version for the educators to be able to use, so that it's a very simple, there's only 3 numbers. You know, if it's 3 and it's red, you can't go, and you really need to look at minimising that risk.
Yep.
If it's green and 1, then, you know, then everything's fine and you've minimised the risk as much as you can to prevent that from happening. So it definitely was trial and error at the start. But now with the more simplified matrix, it's definitely helped the educators.
And have you ever looked at the CEQA department one that, you know, that they're using at the moment? Is it similar to that, or have you not looked at theirs?
We have. We did originally when it first came out, and we did use that as a base. And then obviously, because we are a council service, they also had their matrix that they were encouraging us to kind of use. So it was kind of looking at them both and then working out the most simplified version.
Yeah.
Where the educators were going to be able to meet the expectation of a seeker in the department, as well as, you know, meeting council's expectations around what they needed for their requirements.
Sure. Okay. So the department has told us that sometimes educators don't think about the hazards en route to where the excursion is. How does your service ensure that that happens? You know?
So I guess originally it probably wasn't something that we pinpointed either when we very first entered risk assessment world for excursions. But definitely as information came out from the department with ideas around, you know, what should actually be in a risk assessment, it definitely made us review and have a look at that. I think supporting the educators by having them actually send their risk assessment in first, we're able to actually kind of go through. They're traveling in a car, so they need to, you know, think about things like if they have an accident, how they're going to minimise that, getting in and out of the car, if there was road work. So little things like that, we've kind of now, by having it in practice and having those templates available, the educators are looking at that from all angles. So they are now looking at, you know, things that potentially could happen on the way. If a child takes their seatbelt off in the car, you know, what are they going to do to minimise that risk, and what steps are they going to take if that does happen to reduce the risk of harm to the children?
And is that something that you've found that the department has raised with you on, you know, during assessment and rating, etc.?
So we have just recently had our assessment and rating going back only 5 weeks ago now. So they did look at our risk assessments, and they didn't question anything on it and said that it met the requirements and that we seemed to have everything covered. So they did look at all different types of excursions. When they looked at it, they looked at walking excursions, school drop off and pick up, as well as, coming to our play session. And we've got a few educators that do catch a bus that we provide. So they wanted to see all the information for that. So yeah, they seemed to be.
I take it you haven't got your results back yet.
Yes, we do have our results back. So
how'd you go?
Well, we got exceeding, so we're very
congratulations.
Excited. Yeah, very excited to have received that. So,
were you exceeding before, or is?
Yes, we were able to maintain our exceeding rating.
That's brilliant. Okay,
yeah, very excited about that.
I'm sure you are. So some of your educators do drop-offs of school and picking them up. Talk to me about that. How do you handle risk assessments for those?
Yeah, so any outings or transportation for the children require the same risk assessments. So the educators are required when dropping off or picking up to and from school. And we also have some educators that are supporting families at the moment by doing dropping off from the home, taking them into the service and then dropping them back in the evening. So those risk assessments are handled the same way. They need to look at drop off and pick up. So how are they actually managing dropping the children off? What are they doing with the other children that are in the car? How is all of that managed and how are they going to minimise those risks? So it's definitely still has a risk assessment attached to it.
Yeah, sure.
And it looks exactly the same.
And would most of those be dealt with as regular, as a regular transporting, so that you'd only have to do it once a year? Or?
Yeah, so what we've done is for the child who is being actually transported, they have a transportation authorization form that we get them the families to complete to give permission for that actual transport to take place. But for the other children in care, it becomes a regular outing because they're not being left, at the school or at their home. It's just a regular outing for them. So that goes on to their regular outing authorization form. And so that way they've got permission for all of the families.
Sure. And I was interested that you said that, some educators are dropping from home and picking up from home. What kind of circumstances would that happen in? I didn't realise that was something that, educators were doing on a regular basis.
Yeah, so we have a few. We've got one or two parents at the moment who have medical conditions which don't allow them to actually be able to drive all the time. So the educators are actually supporting them by picking the children up from their home and then bringing them to the service so that they can still have that education and care period of time. They still get to interact with their friends and engage with the educator and have that experience, and then the educator then drops them home. So we have had other instances where parents have, lost their driver's license and things like that, but are still requiring care to continue. Yep. So to be able to facilitate that so that the children, looking after the children's safety and health and well-being, the educators have been more than happy to support that where they can.
I think I'll file that piece of information in. You wouldn't see this in centre-based care, would you?
No, not at all. Not at all.
Okay, so how do you handle regular excursions? You have a one-off authorisation form and you have a one-off risk assessment. Is it like at the beginning of the year you say to all your educators, think about what your regular excursions are, or...?
Yeah, so we used to do it in February. Every February, the educators used to complete their regular outing form as well as their risk assessment. When the new regulations came into place, there was obviously changes that had to be made in October last year. So it's now moved to October. So each October, the educators will actually redo all the forms. And then get the parents to re-sign those, and then they last for the next 12 months. If there is a change in regards to the venue or a regular outing that say they're no longer doing, then those forms would then be recompleted and the parents would have to sign, but they still need to do them again in October. We keep it as a general rule that regardless of the amount of changes, every October they get redone. And that's just so that we don't miss any. So we don't have some educators that are, you know, in May and then some in November, and then you lose track of who's actually got them done every 12.
Done in time, yeah, okay.
Yeah.
And I understand that your service has a checklist that educators follow for excursions. Why did you develop this checklist?
So we just found that as part of our risk assessment, we could have all the minimisation, identify all the risks and have the minimisation and have the matrix and have that all in play. But for, you know, those routine things that they need to do for every excursion and make sure that they have their compliance checks done for car restraints and that they've got their first aid kit and all of that stuff, we just felt that if we had a checklist where the educator could actually tick off that that they've done that for the excursion, as well as put in any comments, so like around bathrooms and nappy change and sleep time and how they're going to meet that, it just gives them a bit more of a black and white quick check. Yep, okay, yep, everything's good for that excursion. You know, none of those risks have changed. I've got everything that I need to, and off I go. It's kind of like a quick reference for them so that they don't miss things when they leave to go on excursions.
Yep. Well, can I just ask, I've spoken to some educators sometime that basically in almost their entire family daycare consisted of excursions, like the children would be dropped off to their home and they'd set off to the local community in different ways, etc., or maybe sometimes going further than the local community, but the whole day was spent out and about. And I always thought that this was really good and a wonderful way of doing family daycare, a wonderful way of ensuring children were present in their environment. But over the last few years, I've noticed that there's less and less willingness to do excursions, probably because of the amount of, of risk assessments that we've got to do. Do you find that your educators are still seeing it as an important part of their practice or less so?
Look, I think it really depends on the educator and the families that they've got within their service. We definitely do have educators that are out and about, 4 to sometimes even 5 days a week, for part of their program. So whether that be in the morning, going to a different group or going to a play group or coming to our play session or having a morning tea at a park with another educator. So they are quite active in that sense. But then we do, on the flip side, have other educators who will only come to our play session as their once a month minimum requirement, and then not do any other excursions. Now that is twofold. Some of them, because they don't drive, they don't feel potentially confident to take the children on public transport to get them to places, so they might do a walk around the block or something. But the other thing is that we do have some families that actually request educators that don't go on excursions because they don't want their child to actually leave the service. So I guess it's finding that happy medium when meeting parent needs and what they're requiring and what they want for their children, as well as, the educators meeting the needs of those families who do want their children to be out and about in the community and very active in excursions in that sense.
And as a service, is that something you talk about with educators so that you try and get those reluctant ones, who do have licenses but are still reluctant to practice it a bit more, and you maybe, get some of the others to think about parental, what parents want? Like, is it something you talk about?
Yeah, I guess definitely through our prospective educator training. So when educators are signing in with our scheme, we do absolutely have those conversations about, the importance of engaging within the community and, but also respecting parents' wishes. So at the end of the day, if you are someone who wants to go out and be in the community and have those excursions, then you need to be really upfront with parents when they're enrolling in your service. This is my routine, this is my program, we do go out in the community, how do you feel about that? Engaging that, because potentially if you've got an educator that wants to do that and families already in that service who love that, and that's part of the reason that they're with that service, and then you've got a family that doesn't want to, you need to find that balance. Maybe we need to find another educator for that family who's not going to go out on excursions, because you don't want to hinder everybody and you want to meet the needs of both parties. So it's just about that compromise.
And educationally, what do you think there's value in excursions?
Oh, absolutely. I think that the children gain so much out of it. I mean, we've got educators that are going to supported play groups where children now have access to OTs and speech pathologists. So, it's giving them that extra a lift, especially before they're going to school. Excursions to local parks where you're giving children the opportunity to engage in that risky play in a safe environment, and really get out in nature, especially for educators who potentially don't have a big backyard. It's giving children more opportunities, but I think it also allows the educators to grow and develop and engage as well. So, if they're going to a park and meeting up with other educators, they're getting that social outlet that they need, and they're learning from other educators. But, and if they're going to a group where there is, potentially an OT or a specialist there, then they're gaining those skills around activities and things that they can be doing with their children to then take back to the service. So I absolutely think they're beneficial. And it's something that we do advocate for, especially with play session, even when we do have parents that are very worried about their child going on an excursion. We invite them to play session to come and see what it's about, to come to the service and see that, to go on the bus run with the educators and the children so that they can engage and see that it is safe and potentially what their children are going to get out of that. So we absolutely do encourage it, and we try and educate the families around that as well.
For sure. Okay, last question. What is it that your educators most have problems with around risk assessments, around excursions, around transport? What do you as a nominated supervisor scratch your head and go, why can't they get this?
Look, I have to say I'm extremely proud of all of our educators. They have worked extremely hard, especially those ones that do a lot of outings, to understand the risk assessment itself, the matrix, and how to complete that. So I do need to take my hats off to them because they have done a brilliant job. At first, it was a lot of hard work, and there was lots of moments where I was like, oh my goodness, how are we ever going to do this? Are we ever going to get excursions out and rolling again? But yeah, I think the hardest thing for them was the matrix and that understanding of, in the first column, you have to put your risks in, and then you have to rate what your risk is, so how high that risk is. Then in the next column, it's your actions. How are you going to minimize that, or how are you going to deplete that from that risk even being there, and then regrade it. So, it was finding that and, trying to explain that, the first lot of numbers and letters that you put in against the actual risk. The second lot is once you've minimised it. They need to be different. And obviously once you've minimised it, it needs to be lower. So, with people who don't have that kind of risk background, that's probably something really hard to gauge and to get your head around. So it did take them a little bit of time. But like I said, with support, I think if you're providing your educators with the support and knowledge that you have, it helps them to understand. And the more they do it, it's like everything. The more they do it, the easier it becomes, and the more second nature it is when they're actually completing the forms.
And I think that's true probably of everything that we do, isn't it?
Yeah.
Thank you very much for talking to us, and thanks Campbelltown for also sharing your checklist for excursions. That'll be part of everyone's further reading for this topic. But congratulations on your rating. Are you tempted to go for excellence now that you've got exceeding?
Yes, the temptation is there. So maybe watch this space, but yeah, we'll see how we go.
Okay. Thank you very much.
No worries. Thanks, Lisa.
Well, again, some great information there and something that can really help you all to understand lots about excursions and risk assessments. And it's great to hear really practical advice there that can share hopefully some really tangible ways to be able to implement effective risk assessments. And I hope that some of you have been inspired to try maybe to take some children out on an excursion into the community that you're part of and maybe have a go at doing a risk assessment yourself. But lots of really great information there to share. So now what we're going to do is have a look at the Q&A and see whether there's some questions there. And we have a couple of questions that we want to share with you today, but one that's come through already, which is fantastic that you were able to share that in advance of today. So I just want to share that particular question with you all because I think it's a really important one that you might want to clarify. So let me bring it up so that I can share it with you. The question is about I'm a member of the PD in Your Pocket Facebook group. So remember, PD in Your Pocket Facebook group. We'd love to hear your thoughts and comments there. And of course, a great opportunity to be able to share some of those things with your colleagues about what works successfully. So one of our members in the PD in Your Pocket Facebook asked for an interpretation of the following words in relation to regular excursions and authorisations in relation to that. So let's have a look at that because I think it's important for us to clarify what those things mean. So they wanted to know particularly what was required for the part when the child is to be taken on a regular excursion. So whether the description of the proposed destination for the excursion needed to be an actual address or the environment for the regular excursion or the regular outing. And whether we needed to fill in the period in which the child would be away from the premises, whether we needed to be specific about the time or can it be a generalisation. So we thought we'd ask the Department of Education for clarification. Very important to go to the source of this information and get some particular information in this regard. So the department has helped us out and they said that when we could use the description such as the third Thursday of every month. So that's quite specific. Every Monday, weather permitting. It's a good way of describing it. On a Monday and a Wednesday and a Thursday when the child attends the service, or something like as otherwise arranged with the parent. So really quite specific descriptions that are helpful so that people know exactly what you're talking about in terms of the time. They said that given these requirements are meant to cover something that occurs on a regular basis, then there should be at least some certainty as to where the regular outing is going to occur. So in regard to the two questions that were asked as well, they said that it's important to remember that the intention of including the details is to provide a family with information about their child's participation in the regular outing, and it's up to providers and services to determine what information about the regular outing is necessary to allow parents and families to be provided with the information, the informed authorisation. So you have a think about your particular context, what's going on for your families, perhaps ask them for some more clarification about what they would need to know, in addition maybe to the information that you're required to share with them. So you might have some context information that will be helpful to share with families. It may involve a conversation, as I said, with families, some consultation, broadly some surveying of families. It might also be helpful to consider when a parent would understand where their child will be going and when upon reading the authorisation, so they get really clear information. So regular excursions and regular outings are a really important part of early childhood education and care, but important to do that in such a way to make sure that the information is clear and is compliant. And remember that a lot of the information here that we've talked about is about being consistently compliant. So making sure that we do the right thing all of the time in relation to our existing practice. Now, thank you so much for all of the questions that you have asked, and it's fantastic to see such a huge amount of questions here. Now, some of these questions are very specific in terms of the way we understand about Australian standards, for example. So generally speaking, I would be recommending that you make sure you ask the place where you are purchasing, make sure you ask that specific question about Australian standards. Remember, we talked about the fact that things that are sold in Australia must meet those standards, but it's really important that you become familiar and aware of that by asking some of those questions. So be really informed about that and ask specific questions. Don't buy something that you are not certain about. Perhaps check with your colleagues in your family daycare service so that you can get clarification. Perhaps your family daycare service has some recommendations about things that they have purchased or other people have purchased that they think are really helpful. But in any case, don't buy things that you're not sure about. Don't use things that you're not sure about. Make sure you have some of that information. Again, lots of questions around particular specifics around children sleeping. And I think we might leave some of those for the Family Daycare New South Wales team to clarify, because I think it's really important that we get very specific information around that. And there's quite a number of questions too around excursions, dropping off children. And remember that there's some information that we've covered in relation to that, again going back into the regulations and clarifying that. If you're not sure about those things, then making sure that you go back into that specific space. For those of you who are using assistant educators or educator assistants, it's really important that indeed they are moving to a qualification. So we do want to really be clear with you that they are moving to a qualification. So they might be enrolled and participating, moving towards a qualification, or indeed have a Certificate 3 or a diploma qualification. So it's important for that to be taken care of. And of course, many of you are asking some COVID related questions. So you might want to reference some of the material that has been developed around COVID and the restrictions in relation to that in your practice by visiting some of the other material that is available. And I'm sure your service and indeed New South Wales Family Daycare can point you in the direction of some really valuable material for your work in a COVID related time. So talk a little bit more about that in relation to your own specific circumstances. So it's really also great to see such fantastic questions about the ways in which you might undertake and support your practices in the safe sleep space. So again, lots of different questions here just to clarify the expectations. So remember, we focused our attention on making sure that nothing was in the cot, that the cot was safe and met standards, that we really paid attention to the environment that we're in, that we also made sure that the children were positioned in such a way as to be at the bottom of the cot. You heard Lisa talking to the midwife, the chief midwife from Rednose, to talk a little bit about those processes as well. So making sure that they're using a sleep suit that is well fitted and that provides them space to be able to move as well. And of course, those checks about being purposeful in your checks with children, and to make sure that you are listening and really making sure that that's part of the regular routines of the work that you are doing. And in fact, some of you have noted that in fact we check all children. So I agree with you. It's something that we would check for all children, making sure our safety practices are really strong and that you've developed really effective sleep practices, policies and procedures that are regularly and consistently followed. So again, really important opportunities for us to continue conversations. But given the nature of our conversations today, I'm going to invite New South Wales Family Daycare to take some of these on notice, these questions. But lots of the things that we've talked about today will answer some of the questions that you've posed. So you might want to go back and have a look at some of the, or listen again to the information we've shared, or in fact, check out the material that's been sent to you prior to today's webinar and after today's webinar. And again, thank you very much, everybody, for your participation today. We know that's a lot of comprehensive information, and indeed we would really welcome your feedback. Your feedback in relation to this work is really important, and if you've got thoughts or ideas, or you want to continue the conversation in the Facebook page, those things are incredibly well supportive of these opportunities for ongoing professional learning. Thank you very much, everybody, for your participation tonight. It's been fantastic to hang out with you in PD in your pocket, and we hope that whether you are listening to it live tonight or whether you are taking an opportunity to do so as a podcast, that this information has helped us all to make sure that we look out for the best interests of children all of the time, and that we are compliant consistently every single day with every single child. Thanks, everybody, for your participation tonight.